everyone, I'm Sheikh, a second year BVSC student, and today I have with me Dr. Mudasir, an expert from the Department of Veterinary Public Health. Today we are diving into a very important topic, Q fever. Thank you sir for being here.
Thank you for inviting me.
सर पहले मैं आपसे पूछना चाहती हूँ कि ये क्यू फीवर होता क्या है बेसिकली एंड ये कैसे लाइवस्टॉक से ह्यूमंस में स्प्रेड होता है.
This Q fever is a zoonotic disease and it affects wide range of animals. But जो primary importance है that those are domestic animals like sheep, goat and cattle. And this disease also gets transmitted to humans from these infected animals. So this disease is caused by an intracellular pathogen which is called as Coxiella burnetii. So this pathogen is quite resistant to environmental stresses जैसे heat हुआ, dryness हुआ और different disinfectants हुए. And coming to the second part of the question कि ये transmit कैसे होती है from animals to the humans. So the primary route of transmission is through aerosol or dust which is contaminated by this pathogen. That's the primary route. From after inhalation, from lungs it goes to alveolar macrophages, then via blood to different organs like liver, spleen, and other organs, and there it gives the symptoms. And it can also get transmitted through direct contact with, for example, जैसे aborted material हुआ या contaminated premises हुए, and then when we touch our mucous membranes, it can also get transmitted through that route. The other less common route is through ingestion of unpasteurized milk, as it is transmitted in the milk as well, or rarely it's also transmitted through tick bites. So these are important routes of transmission जो जिससे ह्यूमंस में डिजीज लग सकती है.
थैंक यू सर फॉर द इनसाइट्स. सर अब आप मुझे बता सकते हैं कि इसकी क्लिनिकल साइंस क्या है ह्यूमंस में एज वेल एज एनिमल्स में, एंड सर व्हाई आर पीपल हैंडलिंग बर्थ प्रोडक्ट्स एंड द एनिमल वेस्ट एट हायर रिस्क.
ये दोनों क्वेश्चंस दे आर वेरी इंटररिलेटेड. सो द फर्स्ट थिंग इज कि ये सिम्टम्स क्या है ह्यूमंस एंड एनिमल्स में. So in humans, it's expressed in two forms, acute form and chronic form. So acute form में क्या होता है? It is characterized by acute febrile illness, जिसमें symptoms जैसे fever हो गया, myalgia हो गया, there is coughing, there is hepatitis as well. So जैसे typical pneumonic symptoms होते हैं वैसे इसमें भी symptoms आ सकते हैं. And then the chronic form, जो chronic form इस disease की humans में है, that is rare, but it is more prevalent in those who have prosthetic valves और जिनको valvular diseases होते हैं जैसे heart की disease होगी. So it causes endocarditis in those patients and it can lead to death. So it can also cause vascular infections in humans as well. Then coming to the symptoms in animals. So in animals, this usually are asymptomatic animals, but the most common clinical manifestation is abortion and stillbirths. There is retained placenta. There is reduced milk production in animals. So it puts economic burden on the farmers as well.
Okay, sir. Now let's talk about how we can prevent it.
Okay, so prevention of this disease can be with simple measures. The first thing is how we can prevent ourselves. That is, चाहे वो फार्मर हो, चाहे वो वेटरिनरी हो या पैरावेट हो. सो वी कैन यूज प्रोटेक्टिव इक्विपमेंट्स लाइक ग्लव्स हुए, जैसे एप्रन्स हुए, जैसे गमबूट्स हुए, सो दैट इफ द अबॉर्शन इज ड्यू टू दिस infective agent, then we may not contract the infection. That's the first thing. Then the other thing is that we have to dispose of जो fetal material होगा या stillbirths होगी, that's to be disposed of properly. तो वो हम प्रॉपर बरियल या इंसिनरेट कर सकते हैं उस मटेरियल को, सो दैट द इन्फेक्टेड मटेरियल इज किल्ड, एंड देन वी शुड डिसइंफेक्ट द प्रेमिसेस व्हाइल एन अबॉर्शन हैज ऑकर्ड सो दैट दिस इन्फेक्शन डज नॉट स्प्रेड इनटू द एनवायरनमेंट. दूसरी एक चीज़ है, देयर इज वैक्सीनेशन इन एनिमल्स. मेनी ऑफ द कंट्रीज दे रिकमेंड वैक्सीनेशन, लेकिन इंडिया में अभी रिकमेंडेड नहीं है वैक्सीनेशन इधर इन एनिमल्स और ह्यूमंस. और एक चीज़ है, अगर एनिमल्स लैम्बिंग हो या काविंग हो, it has to be done in separate panel, so that if there is abortion and due to this infectious agent, it doesn't spread to other animals. It is to be done in isolation. So these preventive measures can help in stopping.
Really brings us to the bigger picture, the One Health approach. सर ये जो डिजीज है ये हमें कैसे याद दिलाती है कि हर एक फार्म प्रैक्टिस जो है वो वन हेल्थ को इम्पैक्ट करती है.
So this is a very good example wherein One Health approach can be effective in control and prevention of disease not only in animals but in humans as well. So, as you see, a small event at a farm like abortion can contaminate the farm, can contaminate the environment, and then this disease can spread to humans and the farmers and the community level as well. So there is a role of a veterinarian, there is a role of environmentalists as well as medicos to come together for effective mitigation of this disease in animals, in the humans, and as well as the environment, and by creating awareness among the masses so that One Health can play an important and effective role in curbing this disease.
Thank you so much, Dr. Mudasir, for shedding light on this topic. Q fever may not always make headlines, but it's a powerful reminder of how interconnected our health systems are. Thank you, everyone. Stay safe and keep supporting One Health.